this is something that impacts so many individuals because our hair is often a huge reflection of, what's going on internally in the body.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, I've just been thinking about all the hairy situations that we get into in clinic. What do you think?
I know. Well, I think we got to get to the root of it. There's no way around it. We really have to think through hair loss and patients who come through our clinics and complain of this really prevalent problem. I have no better words to say it. It's really common. Everybody's suffering from this. Sometimes it's very extreme. Sometimes it's very minimal. And, I always wonder, is it something that we eat? Is it something that we put on our skin? Is it something that is in the environment? And we really need someone to help us look through the evidence and understand, why is this happening?
Actually, when we're thinking about hair loss, I think taking an integrative approach makes such a huge difference. And today we're in for a treat because we have Dr. Rubaina Dang, and she's a licensed naturopathic doctor practicing in California, and she specializes in hair loss. So she's able to really take in all of the integrative questions that you might want to ask and bring in an integrative approach. Obviously, we know about the pharmaceutical approach, but I think the question that lingers on a lot of our mind is, wait, there's got to be other approaches too that could be involved. And of course, Rubaina, we're super excited. Ruby, we're very excited to have you join us on the podcast and talk hair.
Thank you. I'm so excited to be here. This is one of my favorite topics. So the fact that I can just hang out with you guys and talk about it is a dream come true.
Now, Hadar, tell me, man, if you were told you were going to see a bunch of hair loss patients in clinic, what would be the first thing you would say if I said, we're going to line up 50 for you this week?
Well, let me just say this is a challenging clinic because it's really a devastating issue for the patient suffering from it. Now, if any of you have seen me in person, you know that I don't particularly care about the appearance of this, but for many people, this is really, really devastating. And I think there was some survey that suggested that even in women who are undergoing chemotherapy for breast cancer, something like 9% would have done away with the treatment, a life-saving treatment, just because it would affect their hair. So certainly this is really a problem that is really encompassing the psyche of many, many people, and often is a real inflammatory disease that suggests something else is going on the inside. So I don't want to sound like this is all just benign hair loss. A lot of this have to do with pathology that is on the inside. So in all aspects, this is a big problem, and we have some solutions, but we're far from a panacea. And so Ruby, let's dive into it, and maybe you can tell us, what do you do in clinical practice? Just describe to our audience, what kind of person that comes in to see you in a naturopathic practice focusing on hair loss can expect to experience in their first visit?
This is a great question because by the time someone's in a naturopathic doctor's office, they've probably already been to, a couple of different doctors, their PCP, maybe a dermatologist. They've probably tried, the topical, whether it's finasteride if it's a male, the minoxidil, Rogaine, and they're either wanting to get to the root cause or they're not noticing, the results that they're hoping for. So once they walk in, probably the biggest thing that I do, which a lot of other naturopathic doctors do, is we really just take the time to sit and listen. So we listen, I hear their story about, the timeline of when their hair started changing, what was going on in their life, and to really try to get to the root of it. So when coming to the root cause of hair loss, it's a very multifactorial, type of approach. So many factors can influence our hair. It can be from stress, and stress can be even from, let's say a single event to chronic stress to even, an illness to a high fever to an injury to a car accident. All of these things can be really stressful on the body. And outside of that too, hormones play such a significant role when it comes to our hair. So, something that I educate my patients about is, the significance of the specific hormone DHT. And so, it's common that, men more so have androgens in the body, but educating in women, especially that, women also have androgens too. And particularly this DHT hormone can elevate, in times of perimenopause and menopause. It can be in reproductive years. So we just kind of talk through, how hormones can play a role. But other things outside of, just stress and hormones that oftentimes kind of get mislooked is looking at thyroid concerns, blood sugar concerns, inflammation, our digestive health. And so just really taking the time to, understand these other aspects of our health to see how they all contribute to our hair too.
Well, Ruby, before you go on, I mean, this is not necessarily the training that you might get in naturopathic medical school. I know for sure, like in allopathic medical school, we definitely don't get this training. In residency, you do. So I'm curious, how did you get really interested in hair, and what's the background that you had from naturopathic medical school to, getting the ND? And did you start in hair, or did you do a lot more kind of general stuff? And then how'd you hone in on hair?
Yeah, so I'd say hair wasn't, my first passion. My first passion was definitely dermatology. So for me, it really started with I love anything skin related. So that being said, I spent a lot of my naturopathic education, just really trying to advance my knowledge around dermatological conditions. With that, we see a huge gut component too. So that's kind of where I started my journey. But that being said, I did my residency during peak COVID. So that was the time when, everyone was going through a lot of stress. Everything was shut down. And time again, I kept seeing people mentioning how they're losing their hair. And so I decided to really dive into the literature around it, really try to understand what was going on around it. And then I also got involved with the hair supplement company, Nutrafol, and I started working with them as a hair health educator. So I learned a lot about, all of the different concerns of what goes around with our hair, the factors that influence our hair. And then I just started to hear a lot of people's stories and finding, different themes and hearing similar just kind of patterns repeat over and over again, that I just started to recognize, this is something that impacts so many individuals, because our hair is often a huge reflection of, what's going on internally in the body. And from much more of a physical standpoint, our hair is associated with our identity. So when we feel like we're losing our hair, it kind of feels like we're losing parts of our identity too. And so I wanted to just support people, not only on a physical level, but also on this emotional level too.
I love it, Ruby. Thanks for taking us through that. And I just want to also mention that, you've been part of the Learn Skin group for quite some time. You did the internship when you were a student. Mm-hmm. And I know that really got your passion looking through the literature. And then it's pretty cool to see how you've really happened onto hair as an area of passion. So maybe you can take us through how you approach a hair loss patient. I mean, first and foremost, obviously, there's a diagnosis, but let's assume that it's androgenic alopecia.
Sure.
Because this is clearly one where you get a lot of patients that come in, they're looking at oral finasteride, and then they've got the topical minoxidil, and now you have the low-dose oral minoxidil. And I think we kind of run out of options there from the pharmaceutical side. Maybe dutasteride if we really want to try to push that a little bit more. And, patients have concerns about libido, whether it's warranted or not. It's down to, 1% to 2% or something. But Ruby, tell me, what are the kind of questions that patients are asking? And if they're women, obviously it's even more restricted in what their options are. And how do you walk through the treatment options with them?
This is great because I see these questions all the time, especially when individuals have been given the option to go on either minoxidil or finasteride, and they don't want to, deal with the side effects of it. Or let's say someone is trying to conceive and they're a woman and they don't want to be on medication, or, males are concerned about sexual performance and libido too. So what I then walk through is, okay, let's go through a variety of other things too. So let's test. So that's kind of the first and foremost of what we do is we test to see, is it, elevated in terms of their androgen levels? And if so, we can get a better understanding going from there. But then there's also so many other factors that can be used supportively too. So let's say with androgenic alopecia, most commonly in women, let's talk about, reproductive age women, they tend to have more of an association with PCOS. So as we are starting to know and learning more about how PCOS often has concerns with blood sugar dysregulation. So we even go down to diet to be like, okay, let's go ahead and focus on blood sugar regulation. Let's optimize protein. Let's start your day with at least 30 grams of protein, making sure to always pair your carbs with healthy fats and protein as well. in addition to going through some, other blood sugar, nutrients, which can be helpful, such as, inositol is something that I love. And then specifically for androgens, men and women can use saw palmetto. And so saw palmetto works on the 5-alpha reductase pathway. It's similar to, finasteride. And so that being said, it has similar actions without having the side effects and consequences of low libido too. And it is safe for women too. So that's often something that I utilize in my practice, especially if we're talking more so in the androgenic alopecia realm. But then I also talk to patients about, so what DHT does primarily on the scalp is it can cause thinning of the hair too. And so we have DHT present throughout our body, and we, also have it impacting our scalp health too. So I walk through trying to find topical supportive measures for them, whether it's shampoos, whether it's serums, to see and find things that can also reduce DHT locally to just help to support, thicker, healthier hair as well.
Thanks, Ruby. That is awesome. And, I think one of the areas that a lot of people maybe underappreciate is this glucose metabolism area, because I don't think that's part of the typical conversation, at least in residency, that we're thought to think about. But even just recently, there was a publication in 2019 where they looked at type 2 diabetes, and it was in a large cohort of African-American women. And what they did was they looked at about 5,000 plus women in this cohort, and they found that those that had type 2 diabetes actually had an increased hazard ratio of about almost 1.6, 1.7 to 2, depending on, whether they had diabetes, and also if it was a diabetes that had a longer duration of greater than 10 years. And obviously that's in the diabetic scenario. But I am curious, when you're talking to people, do you have...
And Roger, that is a risk for what? Hazard ratio increased risk of what?
For severe hair loss, central hair thinning.
Oh, got it.
Yeah. So severe hair thinning. Thanks for clarifying. And as the diabetes goes on longer, so it kind of highlights the fact that we don't understand the role of metabolic syndrome and in hair and hair loss. But gosh, maybe it's not such a far-fetched thing, because, one of the big questions is in PCOS, we always think about DHT as a driver. But is there a glucose component in there? And so that'll be interesting to see. When you're talking to people about, different approaches, how do you take the approach of building in pharmaceuticals versus not? Because I'm sure many folks come to you and say, I also am on pharmaceuticals. How do you approach that, Ruby?
So with that, that's where the integrative approach comes in. So, having had training in the pharmaceutical lens too, you can come in to make sure there's no interactions. But I then look at, okay, what nutrients need to be supported? Are there any nutrients that are depleted as well? And are there other pathways that we can support? So that being said, say we're going back on the subject of androgenic alopecia. Commonly, especially with DHT levels and potentially blood sugar dysregulation, other common nutrients that can be helpful too are things such as, zinc, omegas, looking at B vitamins, iron levels. So also just trying to assess to make sure that there's no potential deficiencies there, because we've definitely have seen, with low ferritin levels, that contributing to hair thinning, hair shedding and breakage, elevated thyroid antibodies as well too, potential autoimmunity with, ANAs and inflammatory markers. So I know I'm kind of deviating from your question about more so working with the pharmaceuticals, but that's kind of how we do that, is by also making sure just kind of generalized foundations for health are being supported too. And on top of that, making sure people are sleeping, because when we don't get adequate amount of sleep, we're not able to rest, recover, repair, and also focusing on stress and cortisol levels too, because cortisol is one of the biggest drivers for hair loss too. So once you kind of finally optimize the foundations, you can really meet the patient with where they're at. If they want to be on medication, that's great. That's their choice. Amazing. What else can we do to support them, whether it's topically or internally or just mentally and emotionally while they're on that journey too?
I love this conversation, because now you're really honing in on the fact that hair loss can have so many contributors. So it's probably hard to just have you do a blanket statement. I do want to do a patient scenario with you a little bit later. But I think when we're thinking through hair loss, just to kind of summarize what you're saying is that, yes, you have the pharmaceuticals, but you also have where their stress levels are at. You're also looking at what their nutrition is doing. How is their sleep doing? So do you use any functional tests to help you in assessing these things? Because if we're taking a holistic approach, how do you assess the patient? Obviously, you have history and you have the exam, But do you do any functional testing like for hormone testing or for microbiome testing or any other testing, that you include as part of your functional regimen, especially if they're interested?
Yes, absolutely. I love functional lab testing. I mean, I think that's a huge foundation of my practice. So just kind of beyond the lab tests that I just listed off earlier. So, starting them with just looking at markers for health, like I mentioned. So thyroid, iron, B vitamins, magnesium, zinc, all of that. But looking at hormones specifically, I really love to do urine hormone testing, primarily through Dutch testing, just because I like to see how much of the hormone is more so available and not bound to the protein in blood too, so more bioavailable. So it's a great way to assess to see that DHT hormone specifically. We can look at their cortisol rhythm throughout the day as well too. We can see, are they having any concerns with methylation? Are they not, able to methylate their B vitamins as effectively? It also even tells us markers about, gut health and neurotransmitters. So it's just a great way to just get an overview of just more so hormonal and adrenal health. But beyond that, I also really love to do gut microbiome testing. I think it's such a great way to look at your, gut landscape, just because we haven't even dived into this, but our gut microbiome plays a huge role with our absorbability of nutrients too, and which also impacts what we're consuming and the amount of nutrition that our hair is receiving too. So looking at the stool is such a great way to get an internal landscape of health. And then even beyond that, if we're also assessing for inflammation, we can look at food sensitivities to see, are there any foods that are producing higher amounts of, of an IgG reaction? And if so, it's okay to temporarily remove the foods, heal the gut, and, try to reintroduce them, but really just trying to reduce that overall inflammatory load can play a huge role.
I love this conversation, Ruby, especially because we're talking functional testing. So it makes sense that you would do some expanded hormone testing because you can really delve into, the subsets of the hormones. I just want to add that when Ruby was mentioning the cortisol testing, stress testing, it's a 4-point cortisol, which I think is really nice because I think that is probably the most validated way to actually check stress levels is that cortisol slope. So, there's that. One of the things that I think we've been talking about more and more is mitochondrial health. And I've been doing a lot of organic acid profiles. I know that there are a couple of companies out there, Great Plains, Diagnostic Solutions, Genova. I tend to do the organic acid testing that isn't the one that's from Great Plains. I found the other one a little bit easier for me to use, but either of them are great. I find that helps me walk through whether their mitochondria are working at full blast. And sometimes that's a hidden clue that, the thyroid maybe isn't up to speed. But do you utilize that much, or is that something that you incorporate?
I absolutely do. So especially with a lot of my derm patients, I'd say less with my hair loss patients, but more so my derm patients, because it allows us to see our mold, potentially mycotoxins and candida playing also a big role when it comes to just overall health. So I get to then assess to see, okay, is invasive candida something that we should also go down the road? With the oat test, we look at, on there's the amino acid profiling, there's the mitochondrial profiling. We can also test to see, are they breaking down their sugars as effectively? Are they breaking down their fats as effectively too? So it's another great insight just in terms of overall health. But actually, before I jump too far into this, one test that I forgot to talk about that I have been utilizing much more and love is doing a hair mineral analysis test.
Yes.
So with this,
tell us more about that.
So look at heavy metals. And so heavy metals play such a big role when it comes to, it can actually impact the cuticle if we're having a lot of pollution exposure. Or, if we're getting exposures to heavy metals in our environment, it can decrease the absorption of our nutrients too. So this is something I've been finding more and more about how toxic people are actually.
Ruby, I think I used to underappreciate this. Hadar, we haven't talked much about this, but I have started to send a lot more heavy metal tests recently for things like just random dilations that occur on the skin, and also for hair that's not growing as strong. I have noticed that people that eat a ton of seafood, some of them actually have a tiny bit elevated mercury level. And I've seen that if we put them through chelation, it's a long process. But I do find that is helpful. And also people that supplement like crazy, sometimes they don't check the quality of their supplements. I mean, Ruby, I don't know what your concern is. My concern level is high when people start ordering stuff off Amazon and they end up getting heavy metals without even realizing it.
That is my worst nightmare, to order supplements off of Amazon. I can't even imagine what's in it because it is so unregulated. So, at least for me, and I'm sure for both of you as well too, making sure supplements are high quality, third party tested, verified that they're free of any heavy metals is so important, because we could think we're doing all of the right things for our body by supplementing, but we can actually be causing so much more harm too.
I wanted to jump in here as a bit of a skeptical, because we mentioned a whole slew of testing. Most of them, let's be honest, is not covered by insurance and can represent a significant burden to our patients. And I want to ask about the utilities. I want to back up all the way to hormone testing. If you find any imbalance, is there any actionable plan that can come with that? Same goes for environmental issues. Can you give me some examples, and to our listeners, as to actionable data? Because I think there's a lot of confusion out there to say, okay, we're going to order this test and that test, but what do we actually do with it?
Sure. So let's go back to hormones. So say we're talking, I know we've already talked about, how saw palmetto can be used for DHT, but also in women too. As women are going through perimenopause and menopause, they tend to have more fluctuations of estrogen. So another hormone that can be helpful for women who are going through that period and there's kind of the rapidly changing estrogen levels can be maca. And I also really love shatavari too for those hormonal changes, especially shatavari postpartum is great for that, more so postpartum hair shed.
So, Ruby, are you saying you'd look at the estrogen levels and the estrogen ratio specifically, and if that falls to a certain amount, then you might add in some of these estrogen supportive herbs on top of maybe whatever the DHT blocker might be?
So I look at the ratio of estrogen to progesterone. So if the ratio is significantly lower, as well as if their metabolites are lower too, I would consider adding in some more of these herbal support to help to support the healthy amounts of estrogen too. But I also look and go back to, why is estrogen being underproduced? And is it more so coming from the HPA axis and the adrenal function? And then I also look at too, why is, if DHT is being produced and elevated, why is that happening too? And more commonly, I've seen for those, those who tend to be more stressed, they either push the cortisol pathway or they push the DHEA pathway. And the DHEA pathway has a direct kind of connection to the DHT pathway. So that being said, I kind of go back upstream to see where is the dysregulation coming from, and often it's the adrenal glands. So then going back there to either nourish the adrenal glands, meaning if someone's in a state of more adrenal burnout and fatigue and they have lower cortisol function, helping to replenish their adrenals, or if they're in a heightened cortisol state, using some herbs and other kind of lifestyle tips to lower and reduce it. So hormones tend to also be a byproduct of more so our adrenal health too. So making sure we're also getting to the root of our hormones is as important.
What I want to add there, and Hadar, we always talk about DHT being elevated, but it's a relative increase. And I think that's where the conversation doesn't go that extra step, especially even in Western medicine. We talk about DHT being elevated as if DHT went up, but that's not necessarily true in women. What could have actually happened is estrogen went down and the ratio went up. And so when we're sitting there blocking DHT, what could have been helpful is supporting the estrogen levels to be back into a more physiologic range when they were, premenopausal, but doing it in a way that's safer, so you're not elevating the risk for, say, things like breast cancer and whatnot. And so I think blocking DHT is kind of the rudimentary way of doing it, but there's all these other creative ways to just make sure that ratio goes down.
Exactly.
I really think that when we do this, we really have to counsel patients. And like you mentioned, there are certain risks with effectively doing hormone replacement therapy. So talking about blood clots and risk of strokes that can be there, and even a small, moderate increase in breast cancer risk. I think it's really key to understand this and make sure we take our patients through this as we do this in kind of a thoughtful way, so the patients are educated on this.
Can I make a comment on this? Actually, this is a really interesting area, because when it comes to estrogen replacement, I think the blood clots and the strokes, that really comes up when you give them pure estrogen. That's where the risk actually is a bit higher. When you give these phytoestrogens, it now turns out, especially if you look at soy, for example, and one of the ways you can actually address this is soy isoflavones, I should say. So one of the things that comes up with these phytoestrogens is they end up acting as partial agonists. And so what happens is that they don't overactivate the receptor, but what they do is they block your native estrogen from overactivating the receptor, but they can still do estrogenic downstream effects. And so what they found is that in the people that are supplementing with, say, really high levels of soy, they don't have the same blood clot risks. They don't have the same stroke risks. And they don't have in fact, they've shown that when you take a lot of soy, your breast cancer risk goes down. So it's kind of been this differentiation between synthetic estrogen versus the phytoestrogens. There seems to be a differentiation between the two, which is quite interesting.
Right. And if I can add a little point to that too, especially with soy and more of that phytoestrogenic component as well, is we now know we have different estrogen metabolites. We have the 2-hydroxy-E1, 4-hydroxy, and 16-hydroxy. And what soy tends to do is it tends to work more so on the 4 and 16-hydroxy, which are more of our estrogenic types of, estrogen metabolites, meaning they're the ones that produce more of the estrogen symptoms, such as, the ones that women complain of, PMS symptoms, whether it's also, breast tenderness, mood changes, all of that. And so while it might have this, slight increase of potentially of the estradiol, it has this great effect at binding these more so potent forms of these estrogens at 4 and 16 hydroxy and helping to support the body and the liver with elimination of these more kind of pathogenic types of estrogen too.
Okay, Ruby, I think I'm going to give you a patient scenario. I know that you can't, give us like the one algorithm for everything. We were hoping for that, but c'est la vie. But I want to give you a kind of a scenario, and then we'll kind of wrap up with that. So you get a woman that's maybe middle-aged, maybe perimenopausal, maybe not, really struggling with their sleep. And also perhaps her stress is really high. And you can see that with the flattening of the cortisol. How would you approach this kind of patient? And obviously, there's many different choices, but what are some of the things that you would talk them through? And she's on low-dose oral minoxidil and finds that it partially helps. And this is like a lot of my patients, by the way. So how would you approach this?
And I'm just confirming her hair is also falling out?
Yes, I know, clearly, right? Androgenic alopecia.
Androgenic. Okay. So that being said, I go back upstream to getting a detailed history of understanding when did it start happening. A lot of times for women in this age range, it started to begin after, the delivery of a baby or two. So checking back, okay, did it start postpartum or is it after that? And if it happened after that, I then take a closer look at their thyroid because oftentimes, let's say, late 30s, early 40s is a time where a lot of women start to develop, thyroid related concerns. So I first go there, I go to test to make sure, there's no nutrient deficiencies present too. Hearing that she's having trouble sleeping and we know her cortisol is dysregulated, that's the first thing I'll go to is trying to, try to balance that cortisol. So trying to give her more supportive measures for nighttime, whether it's magnesium before bed to help to encourage sleep. If it's trouble falling asleep, there's different herbs to help to support that rather than if they're having trouble staying asleep. So try to assess more so where is that occurring and is it due to cortisol or is there another factor going on in her life? Outside of that too, I'm going to take a closer look at her diet. Because to be honest, and kind of going back to the blood sugar regulation, most people are not consuming enough protein. And I know we're in this huge protein hype right now, and it's for a good reason, meaning everyone's talking about protein, but it's because protein is essential just, for our muscles, but really for our hair. And so a guideline that I give all of my patients at bare minimum is making sure that they're getting at least half of their body weight in grams of protein every day. And so with that number, most people...
That's in kilogram or pounds?
In pounds.
That's a whole bunch of protein.
Yeah, no, Hadar, I think that's actually, what do they say? They say 1 mg per kg. So this comes out to a little bit in that range, right? I believe. So it's close.
Yeah, but this is a lot of protein. The average person in the US is really having trouble getting that into their diet. So I'm not challenging the number. I'm just letting our listeners know that this is a lot of protein and you have to be thoughtful through your diet, how you put that together.
Now, I do have a question. If people are eating meat, though, aren't they getting that level? No?
Not always, yeah.
Oh, I see.
Yeah, one of the best ways that I try to recommend and encourage protein is through 2 ways. So one, through a protein shake, but 2, one of my favorite forms of easily absorbable form of protein is collagen. So especially marine collagen has 18 amino acids that are essential for keratin production. But the thing about marine collagen is it has a higher amount of L-proline, which is more easily absorbable and needed for hair growth too. So that being said, that's one easy way to get a good 10 grams of protein in there. Also, collagen, as we age too, we lose, anywhere from 1% to 2% every year as well. And what a lot of people don't also recognize is our hair follicles actually sit in the dermis of our scalp, which is nourished by collagen too. So as we begin to age born after the age of 30, our collagen stores are declining, and therefore it's not as, I'd say, just nourished and moisturizes enough to hold a healthy hair follicle too. So sometimes just even adding in some collagen can be helpful.
Excellent.
Hey guys, I just looked up the average protein intake of adults. This was a dietary data brief published on the National Library of Medicine. And you guys really bring up a great point. Looks like in the 20s to 39 year group, it's like 112 grams for males, and it goes down to about 83 by the time you get to 60, and it like drops to 100 grams. But that's the average protein intake, 100 grams. And then for females, it starts at 74 in the 20s to 30s, and then it's same at 40s, but then it drops down to 60. So I could see how people fall behind on their protein intake, especially with weights going up in the US. So that's pretty interesting. Anyway, so with that, Ruby, we could talk on, but I just want to say that, this has been an awesome conversation around integrative approaches to hair. Maybe you can just take us out with an overall takeaway, if there's anything that you'd want us to take away when it comes to the integrative approach, and we can kind of keep people interested in maybe a part 2 later on.
Absolutely. I mean, we didn't even really get to talk about, topical or internal ingredients, because there's so many products on the market now. There's so many supplements, there's so many hair care. So that's a whole other topic in and of itself. But I would just say to just kind of keep the listeners out there, informed is, there are many different approaches to hair loss, and it's not always, just a medication. You can get to the root of it too. And, you can also experience and see changes with your hair too. So that being said, I think it is a very multifactorial approach, and it requires, looking at it from a lot of different lenses.
Excellent. Well, Ruby, thank you so much for your expertise, and you left us with hunger for some more, but we definitely are starting to get to the root of this. So thank you for your time, and I hope to see you soon on our program.
Thank you for having me.
And that's a wrap for today's episode. But these conversations are just way too good to end here. Wouldn't you agree, Raja?
Absolutely, Hadar. That's one of the main reasons I get so excited about our conference, the Integrative Dermatology Symposium. Every year, it's a chance for us to continue expanding our minds for what's possible in dermatology for our patients, and also to bring the latest clinical knowledge back to the clinic. And this year's theme has been long awaited. Do you want to spill the beans?
Oh, yes. You don't want to miss this one, folks. This year's theme is Nurturing Skin Resilience, the Science of Aging and Wellness. And it's happening from September 26th to the 29th, 2024.
Yes, and we'll cover topics from conventional medicine to traditional approaches, from inflammaging to exosomes, and from cosmeceuticals to women's health, and more.
The agenda lineup looks amazing. Not only the topics, but also the real-world case discussions, workshops, and networking events. No wonder we've expanded the IDS to 4 days. So much more to learn and do.
Plus, you can't go wrong at a brand new resort that just opened up this year at the Lowe's Arlington Hotel and Convention Center in Arlington, Texas.
Texas, here we come! And for our esthetician colleagues, please join us on Sunday for the Integrative Aesthetics track.
So come check out integrativedermatologysymposium.com for all the details. We hope to see you there.